The anterior veneer course now will continue, and this is going to be part 2. We're going to discuss the facial veneer. And veneers are wonderful things to do, but they're very complicated and they're quite technically demanding. So we want to follow rules so that we can have predictable results. Understand that the indications and contraindications very clearly, because even minimal prep veneers are irreversible. And we have to keep in mind that many times things like orthodontics or bleaching or simple bonding is really the proper treatment. And one of the most important things to remember is function. If the function is not controlled or understood well, we can have failures, which we'll talk about in a minute. One of the things people always ask when they see me is, how long do these last? And if we look at systematic reviews, there have been so many of them, we can see the survival rates are decent. 96% at 21 years in a study by Layton back in 2012 showed a pretty good success rate. But why do they fail? That's always my concern, is why isn't it 100%? And really there can be 4 major failure areas. One is tissue, loss of papilla. Tooth, it can be decay issues. We can have the restoration fracture or debond, and then we can have aesthetic changes like color changes underneath the veneer. But of all the failures that we may encounter with veneers, I would say that the fractured veneer is the most frustrating, particularly if we know the occlusion is correct when we deliver the veneers and we provide the patient with a night guard. The fractured veneer problem may in fact not be caused by nocturnal bruxism, but might in fact be caused by the daily chewing patterns of the patient, which may not even be considered parafunction. So we want to take a look at something called constricted chewing pattern. And constricted chewing pattern has 5 different reasons, and the first reason may in fact be the reason why these veneers failed, because they were slightly overcontoured on the lingual, even though MIP position was okay. The key is to make sure we look at the way the teeth are coming together while the patient's chewing. And in a future video, I'll go over the chew test and how to avoid this type of stress on the veneer, which might lead to an early failure. Another thing we need to consider is, should we even be doing veneers at all? And let's take a look at a few cases here and decide whether veneers are appropriate. In case A, I think we all would agree that orthodontics is the appropriate solution, followed by extensive restorative dentistry. In case B, this unresolved wear pattern might in fact be due to a sleep-related breathing issue. It might be related to attrition due to constricted chewing pattern. It might also have an erosion component to it. But whatever the case is, it needs to be dealt with way before veneers would even be considered. In case C, we have a situation where all of the gingival areas are void of all enamel. So to cover these areas with veneers would be very risky, because the enamel content at the gingival is really what preserves that seal. And in case D, we have a patient that had been sucking on lemons for many years and had removed a lot of their enamel, and this would be a very challenging case for veneers, but perhaps could be dealt with super veneers, which we'll talk about in part 5 of the video series. Some important guidelines include not having more than 2 millimeters of unsupported porcelain. If more is required, we probably should be looking at utilizing lithium basilicate, which can handle this type of thickness, or maybe even going to an all ceramic crown. Another thing that's really important is to remember that including the existing restoration is the standard for veneers. Now, there are occasions when you can get away with leaving a very small class 3 restoration not included, but typically including all restorations provides for a better peripheral seal. And finally, whenever we want to make a shade change on a veneer, we need to remember that we need to prep a little bit deeper. And the rule of thumb here is 0.2 millimeters of additional facial preparation for each Vita shade change that's required. So if we were going to go from an A35 to maybe an A1, we'd need to have 0.7 millimeters at the gingival, which would likely remove all remaining enamel. When we look at the variations that are available for us, we can do facial onlys, which we're going to discuss today, or incisal butts, which is in part 3, lingual wraps, which will be in part 4, and then of course super veneers, which will be the part 5 of this veneer series, which are very different than the veneer preps we've been talking about in the previous 4 parts. How thick is facial enamel? You'd be surprised to know that if we go down to the 1 millimeter from the CEJ location, average enamel thickness, according to this study that was published by this group out of Korea, was only 0.3 millimeters. And it only became 0.7 millimeters when we were 5 millimeters away from the CEJ. So conservation of tooth structure is extremely important. And it's important to follow a very clear systematic approach. Veneer preparations like these that are so conservative and the restoration is so beautiful required a lot of planning. So let's talk about the facial veneer and how we're going to approach this. The preparation is essentially going to look like this on the tooth, and it will not wrap the incisal edge. And for that, we're going to want to use a very well thought out burr kit. So you guessed it, well, we have a burr kit, and this is one that I put together after 32 years of experience performing veneers in all different types of situations. And the veneer kit is quite versatile because we can perform very conservative veneers, just our almost a no prep veneer, all the way to the super veneer. So I'm going to go ahead and crack open this kit and show you what's inside. One of the things that we want to do is have a depth cutting system that allows us to preserve enamel, and we have burrs in here that are designed just for that purpose. So let's take a look at the left hand side here. This is an LVS1 021, and next to that is the LVS2 016. These are depth cutting burrs, and I like these because they are standardized in their thickness no matter where you use this particular depth cutter. We're going to also need burrs that are specialized to remove enamel but also be very delicate at the gingival. And then we're going to want to have some finishing veneer burrs that are diamond grit of 30 micron and can smooth well, and then of course some burrs that can be used on the lingual. And I've got this disc in here, which is a diamond disc. It's quite thin. It's 180 microns thick, and this can be used for interproximal preparations when those are required. And of course I've left a few holes available so that we can add some add-on burrs that we like to use, like the ones I'm showing here, which are incredible for all different types of things. Let's take a look at this facial veneer preparation and get started. This is the stent that we made in part 1, which will tell us how much we've reduced in the incisal third of the facial, middle third of the facial, and gingival third of the facial. We're going to want to use this today to make sure we're prepping correctly. I've got this old model that was made by Dr. Harry Albers, and Dr. Albers was a UCLA graduate, and he has been a prolific writer and mentor, an amazing clinician, brilliant scientist, and I have learned so much from this gentleman over the years. And he made these so many years ago to show what the facial only veneer preparation would be like. And I have tried this preparation, but I have found that the enamel rods at that incisal edge can be a little bit fragile. And so my preparation design has been modified from the Albers design to remove that little lip and have a stronger incisal edge enamel configuration. So the burrs we're going to use today, really simple. We're going to use the LVS2 016. We're going to utilize the LVS4 014. And then we're going to utilize the 8850 012. So in parts 3, 4, and 5, we're going to show you how to use the other burrs on this really awesome burr kit. I'd like to take a closer look at these depth cutting burrs on the left, the LVS1 and the LVS2. Let's look at the LVS2 first. And the LVS2 is the smaller of the two, and it has these little diamond cylinders. It has 3 of them. And if you were to measure the outer diameter, it would be 1.6 millimeters. If you measure the inner diameter, it would be 1 millimeter. So if we do a little quick math, 1.6 millimeters, subtract 1, divide that by 2, we'll get a 0.3 millimeter depth cut. If we look at the other burr, the LVS1, and we measure the outer diameter and the inner diameter, we have 2.1, subtract 1.1, and we end up with 0.5 millimeters for depth cutting purposes. For our facial veneer today, we're going to go with the LVS2, which is going to give us a much smaller depth cut. It's only going to give you a 0.3 millimeter depth cut. And I like the fact that these are all the same size. There are depth cutting veneer systems that have different sizes for different locations, but I would rather have a uniform depth cut and make some changes to that based on what I need in the particular case. So I'm going to use the middle wheel right now to get the initial depth cut of 0.3 millimeters across the facial. Now we would go deeper if we needed to for shade changing purposes, or if there were some other structural reasons for going deeper, but in this case we're going to go with an ultra conservative veneer preparation. You notice how I hold this in the middle third. Now if I want to get the depth cut at the gingival third, I have to tip the burr so that it's parallel to that gingival third. And you can see how the middle third isn't really cutting, it's just the gingival third that's cutting. And we'll get that 0.3 millimeters that we require there. And then we can tip the burr back the other way towards paralleling the incisal third of the facial to get the incisal depth cut. So the burr can be used really easily and very quickly to get the proper reduction that we're looking for. We're now going to move on to the LVS 4014. This is a terrific burr that has very good dimensions for veneer design. It's a coarse burr, which means it's 125 micron diamond grit thickness for the shank, but the tip is only 30 microns in grit and much more conservative. And the tip diameter is 0.6. So half of that tip diameter is going to give us a 0.3 millimeter gingival margin depth. So I'm removing right now the middle portion of the preparation between the incisal and middle portion, this little raised area, very carefully, and then I'm going to reorient the burr so that I remove just that portion that's between the middle third and the gingival third. So I have to always think about keeping my burr parallel to the facial surface in order to conserve the removal of enamel. Remember, we're not dealing with a lot of enamel thickness, and I think that frequently we can get so focused on other things while we're prepping that we're not keeping in mind that the enamel thickness in most cases is very, very little. And you can see that we're going to keep this particular preparation super gingival simply because I want not to damage the gingiva of the typodont, but you could keep these equigingival. You could even make the preparation slightly subgingival, maybe as much as 0.5 millimeter if you needed to. In those cases, you'd want to use retraction cord to protect your gingiva while you're prepping. I like to prep these usually with rubber dam in place so that we have excellent protection of the tissue, but sometimes the rubber dam hides some important features of the tissue that would give us information about shaping and finessing the preparations. So oftentimes it's a good idea to remove the rubber dam when you're doing the fine-tuning of your preparation. And this works pretty quickly. It's no different than any crown prep, except for a major difference, and that is light touch, very, very careful. Don't over-reduce. It's extremely easy to over-reduce. Remember, half the tip diameter on this burr is 0.3, and this gives us a very optimal depth at that gingival. We're going to go ahead and place the stent on here and see that we have decent reduction in that middle third by utilizing this preparation guide over here on the mesial side. But on the distal side, you can see that it's definitely under-reduced. I would not have known that simply by looking at the facial. If we look at the gingival third, it looks to be a little bit more uniform. So we're pretty happy with that particular area. But putting this back together again, we can see that that distal portion might need to be reduced a little bit more in the middle third. The incisal third is much closer to what we would want. If we want to reduce a little bit more incisally to give a little bit more characterization of the ceramic, that's not a bad idea, but I'm going to give you the most conservative possible design for a facial prep veneer. Obviously, a no prep veneer is the ultimate conservative preparation, is no preparation at all. So knowing that I need to produce a little bit more in the distal of the tooth, in the middle third, I'm going to focus my effort there. I don't have to go over the entire surface. I just have to work on that particular area. Then I'm going to go back and check that and make sure that I've reduced it adequately. You can hold the burr 90 degrees to the facial surface too. to create a shoulder. If you think about it, it's really a little mini shoulder, isn't it? And we want to create a shoulder by having the burr perpendicular to the shoulder we're creating, so it would make sense to move the burr at an angle like that. Always remember to include this little corner here, particularly if the patient has experienced some gingival recession. We want to have the veneers wrap around interproximally to cover this area. See, there's the tip diameter. It's essentially 0.6 millimeters, so half of that will give us 0.3. I think owning one of these little micrometers that you can pick up at Amazon for about 50 bucks is well worth the investment. So going back and looking at the prep guide, you can see that our reduction is a lot closer to ideal. We've removed that distal middle section and it's a little bit nicer. Maybe we have a little bit more to go in reduction in that middle third. And on the gingival third, let's tip the typodont back a little bit. You can see that it's pretty good across that area. So the prep guide is an essential feature to reducing the right amount of enamel and not reducing too much. Remember that the line of draw of this preparation is going to go off towards the facial. So undercuts, as you view from the incisal, will be common, and that's completely acceptable. Let's always remember to look at things from the side view, so we're following the contours. And also keep in mind that undercuts are going to be tolerated because the line of draw is going to come off more towards the facial, so the veneer will seat pretty easily from the facial. I'm now going to use the 8850-012 to perform some refinement. We're using the high speed right now just to go across the tooth and remove deep scratches that were caused by the coarse initial burr. The tip of this burr is quite small, can easily get into the interproximal areas, and we're not trying to replace the margins, we're just trying to enhance what we have already. Using the burr obliquely is an excellent way to remove deep scratches. Keep in mind that you can orient the burr in different directions and not just hold the burr from the occlusal aspect. You can tip it more towards the facial to get those interproximal areas. Where do you want to place your margins depends on the case. I'm showing you a case where we're not going to include the contact. There are times when we want to include the contact, and we're going to cover those in subsequent parts of this video series. It's good to assess the situation from the incisal, and remember, you're not going to be able to see those little corners because of the line of draw is going towards the facial. And at this point, we're fairly satisfied with the preparation, and we're going to want to relieve a little bit of undermined enamel, maybe, or little loose enamel rods with a Vision Flex diamond strip. And we can take this and we can easily insert this between the teeth and just move it back and forth and just remove any little loose enamel rods that might be persisting. This is the OptiDisc system by Kerr, and I like this system because the discs are translucent and also you have a soft center to the mandrels. There's a safe side and then there's a cutting side for each of these, and I use these to finesse the preparations further. They fit easily into the mandrel, and I like to have them facing in towards the handpiece so I can pull these towards the preparation, and I tend to have a little bit more control than if I were to be pushing them. I'm doing this in the same way that I might finish a Class 4 composite restoration. And we're starting off with the coarse, which cuts quite effectively, and then we're going to move on to the medium, and then we're going to take that now to the fine. I don't think it's necessary to use the extra fine for veneer preparations, but it is a really good idea to use this series of discs to give yourself a much smoother surface. So here I'm going to switch over to the fine and go over the surface again. Some people argue that it's nice to have a slightly rough surface because it increases bonding, but I can tell you that having a very smooth surface allows my technicians to have an intimate fitting veneer without voids, and we have excellent bond when we're finished. This is Jiffy Cup Green, and this can also be used maybe to remove some irregularities and give a very smooth surface. Not polished, remember, but smooth. Smooth preps mean smooth impressions. Smooth impressions mean smooth die work and stone work, and if we're scanning these, it makes for a much easier scan. So I spend a lot of time making sure my veneer preparations are very, very smooth and uniform. We can use this jiffy in so many different ways. The cup-shaped jiffy can even be run along the gingival, and it will replicate the configuration of the gingival margin quite nicely. So it's really good for a lot of different things. So now I think the preparation is essentially done. Let's go ahead and check it with the prep guide to make sure that we're okay. We have adequate reduction. And we'll start by looking at it from the occlusal third. We see it's fairly uniform, the middle third, and then we're going to look at it from the gingival third. So we're pretty satisfied with the prep, and it would be adequate now for taking a final impression and performing the provisional. We are going to talk about provisionals in part 6 of the series, and I'm going to teach you at least 2 ways, if not 3 ways, to make veneer provisionals. Sometimes veneer provisionals are daunting and labor-intensive procedures, but they don't have to be that way. They can actually be quite straightforward, and I'm going to show you some easy ways of handling that. So I think that Dr. Albers, I want to thank you for your beautiful work, but we did make a modification of our design today, and I think that we both would be happy with the result. So here we have this smooth incisal corner where we haven't wrapped around, but we've just kept that edge nice and clean, and the final veneer preparation is meeting our needs today for our aesthetic dentistry. So I definitely want to thank you for your time today, and I want you to look forward to part 3, which will be the incisal butt veneers, and I'll discuss more concepts as well. Wishing you the best.